But then 4 or 5 months later, I wake up and I'm going to beat the you know what out of this disease. And there's no way I'm going to let this disease define me. I'm going to now be defined on how I deal with this disease. And that's a great stage. And all I would tell you is maybe some of these go in different orders for some of you, but this is the process that we as cancer warriors go through. And some of us stay in certain ones for longer. Some of them may miss one versus the other, but this is real. And as a caretaker or a loved one of somebody who's dealing with somebody with this disease, please understand that this is normal. And the goal is to get to the 5th stage of dealing with cancer.
In my case, I have not had any kidney cancer drugs since that last dose in 2004.
So back in 2007, I had an incidental finding in Washington, D.C., lived on Capitol Hill, was fortunate, had a radical nephrectomy at the George Washington University Hospital, some histology concerns. I was picked up by the NIH and had a cowboy surgeon out there named Gennady Brodslavsky who saved my life.
I am a patient at Dr. Paley's. When I landed at Simon Center, I had one kidney. I had metastasized floating through my body, and I said, I need help. I did join the clinical trials, 2 of them, and I tell you what a great experience that was, because I became the first step, genuine boss and understanding side effects. I had them all, and I said I am not going to quit.
Well, I think the most important lesson I've learned as a patient is to learn as much about your own disease as you possibly can, but also to find the very best doctors who are expert in kidney cancer. And so very quickly in my journey, I had to move away from the most convenient location, close to home, and to travel a little further for me so that I could see kidney cancer experts who really understood this disease. And that was the first time when I actually heard the words hope. Because nobody had very much hope for me when I was 36. They said, this is stage 4 kidney cancer, it doesn't look good. But when I found the right expert in kidney cancer, he had every reason for hope. And so I have continued to be hopeful and to do what I've needed to do, but I owe that, and I owe my survivorship to the expert doctors who have taken care of me.
Choose to live. I know that sounds pretty simplistic, but I'm absolutely convinced that we can choose to die, we can choose to wallow in our self-pity, or we can choose to live and make the most out of that. And that is a choice that nobody can take away from us. And I choose to live. And most of the people that I talk to choose to live. And this is why I call them warriors, because they're fighting to make those choices under very difficult circumstances, depending on what they're dealing with and what their side effects are.